Welcome to page 21 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Today we've talked about joints and articular systems. Now we're going to talk about how they move. In what ways do these joint move, and how do we define certain movements? Let's start with extension. A backward movement here, say of the neck, is called extension. It is the opposite of flexion. It is a movement that occurs in the sagittal plane. Remember, the sagittal plane is this movement, is this plane that divides the body here. It might look something like this, and I'm sorry for the drawing, but that's an awful drawing. Let's see. It's a forward and backward movement. So flexion would be here. You see this person is flexing the neck, flexing the spine forward, flexing forward, flexing the wrist, flexing the elbow, flexing the knee as the knee comes around this way, and flexing the hip upward this way. So flexing is usually bringing two surfaces closer together. And extension, so that's flexion. And extension is the opposite of flexion. See, flexion was bringing everything in and together. Flexing the neck is down, while extending the neck is back. So it's motion in the sagittal plane, backward and forward. And there is a unique term for ankle flexion called dorsiflexion. It's flexion upward when the toes come closer to the leg. That's called dorsiflexion. Dorsiflexion, because this is the dorsum of the foot, and this is the plantar surface of the foot. Dorsiflexion. Dorsiflexion up toward the shin bone. And there is the opposite of that is plantar flexion, which is bringing the toes downward. That's plantar flexion, toward the plantar surface of the foot. So if this is your foot right here, it's got a dorsal surface here, and it's got a plantar surface here. Plantar surface. So dorsiflexion is in the direction of the dorsum of the foot. Plantar flexion is in the direction of the plantar surface of the foot. So let's go through some more extension movements here. Spine extension would be bending backward. Wrist extension here would be bringing your wrist backward. Knee extension is a straightening of the knee. You can see here is even hyperextension. It got so straight that it went the opposite direction. The fingers going backwards, that's extension. Extension generally means straightening or going beyond straightening. So let's say you flex forward, flexion in the neck, and then you straighten your neck and you go beyond. That's hyperextension. You straighten your neck to extend your neck back this way. Extend it back this way. So if you were to do a back bend, that would be extension. If you were to straighten your arm, that's extension. If you were to move your arm forward this way, that's flexion. If you were to bring your arm closer, your forearm closer to your arm. If you were to bend your leg this way, Bend your leg closer to your thigh. That's flexion. If you were to straighten it back, that's extension. If you were to bring this hip up and forward like this, as is in this picture, bring your hip closer to your torso, that's flexion. If you were to bring your hip down and away, back this way, like a runner, kicking backward, kicking your glute backward, that's extension. So generally a straightening. The flexion, as you can see, is bending. It's usually a bending motion instead of a straightening motion. It decreases the angle between the bones of a joint. Movements of flexion are in the sagittal plane, as I talked about, and as well as extension. Abduction, right here. Abduction, adduction, adduction. It's called adduction because we're going to call this one abduction. Adduction and abduction because they sound similar. Abduction or adduction is when you bring something closer to the midline. So let's see. Adduction moves toward the midline of the body. So let's talk about let's say you take this, well, let's start with abduction. Abduction is a better place to start because it moves the bone away from the midline of the body. Here's the midline of the body, right? So let's say this person does jumping jacks and brings their arms outward doing jumping jacks or making a snow angel. So what would you call that motion? Away from the midline of the body, you'd call that abduction. Now in the second part of the movement, so the arms are up here now. Oh boy. Your arms are up here. And now you're going to bring them down. Now you're going to bring them down toward the what? Toward the midline of the body. You're going to bring these arms back down toward the midline. Well, now that's an example of adduction. Adduction toward the midline of the body. Okay, let's try again. You are doing your jumping jacks and you're bringing your legs out away from the midline of the body. Abduction, abduction. And next move, the snow angel or the jumping jack, you're bringing your legs back in toward the midline of the body again. That's adduction, adduction, bringing toward the midline of the body. Circumduction now is a circular movement at ball and socket, condylar, and saddle joints. Circumduction is an all-around type movement, around and around and around. Let's say you take your shoulder and you go take it all the way up and around like this. And you do, like a lot of people do, a windmill exercise on their shoulder. That's circumduction. Circumduction there. Here's adduction here. Adduction. And circumduction. Now, rotation. Let's say you just simply turn your head to look to see what's behind you. That's called rotation. Rotation. Let's say you turn your palms up. Let's talk about supination now. Supination is when you turn your palm up in this direction. And I always think of it as holding a tray of soup or a bowl of soup. You would hold that with your palms up also known as supinated or palms up. Now, the opposite of supination, what if you want to turn your palm down? Turn your palm down toward the floor. That's called pronation. And here we see an example of pronation of the wrist right here. Here, by the way, we see an example of shoulder abduction, bringing back to the midline. Here we see, in review here, an example of leg or hip abduction going away from the midline. Let's back up a little bit here and go through flexion again. What if you were to kick a soccer ball with this leg? That would be an example of flexion. What if you were to kick a ball backward with your heel? Take that ball and kick it backward this way. That would be an example of extension. What if you were to raise your arm to say hello to somebody in front of you? That's an example of flexion. What if you were to reach back behind your back this way, straight back? That's an example of arm extension. Now moving into the ankle. There are special movements of the ankle, two special movements called inversion and eversion. So anytime you invert your foot, it looks like this, where your big toe comes up and in and say off the ground. If you were to sort of walk on this outside of your foot and lift the inside of your foot up, that would be called inversion. If you were to walk the opposite way on the inside of your foot with your knees caved inward and lift your pinky toe off, that would be walking in eversion. Eversion. So ankle foot inversion and eversion. And of course, we already know what this is right here because we already discussed it, right? This is ankle dorsiflexion towards the dorsum of the foot. And of course, this over here is plantar flexion of the ankle towards the plantar. Toe down is toward the plantar surface of the foot. So what do you think this is in the fingers when you bring the fingers out like that? That's extension. When you go to grasp an object, what do you think that is? Here's extension. And when you go to grasp an object, hold a ball or a cup, you flex your fingers. That's finger flexion. If you bring your fingers inward toward the midline of your hand, inward, squeeze them, that's toward the midline. Here's the midline of your hand. You bring your fingers inward. That's adduction. Adduction. If you were to spread your fingers outward, 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 that's abduction. Abduction. Outward. That's abducting the fingers away from the midline. Here's and let's, how about in the wrist? If you bend your wrist backward, what would you call that? Call that wrist extension. Extension. If you bend your wrist forward, that's called wrist flexion. Flexion. And a couple other movements here, lastly. If you bend this wrist in this direction, that's away from the midline. That's considered abduction. If you bend your wrist like this here, toward the thumb side, abduction, away from the midline of the body. The midline of the body is right here. Now, if you bend it this way, that's adduction. toward the midline of the body, toward the midline of the body, toward the midline. So abduction and adduction. Now, these two have different terms as well. This is also known as radial deviation. Here. Why? Because the wrist is deviating towards this bone right here, which is called the radius, radial deviation. This is called ulnar deviation. Why? Because the wrist is deviating toward the side of this bone right here called the ulna. So this is ulnar deviation. And that is the end of page 21. Anatomy coloring book. This is Dr. Stephen Harkins. Until next time.